The Food and Drug Administration approved new COVID-19 vaccines this week, but the agency is limiting which Americans can get the shot. Under the new rules, the vaccines will be available to all Americans over the age of 65. They will also be available to adults and children with a serious health condition. However, the FDA did revoke the use of Pfizer's shot in young children, leaving just Moderna's vaccine for children as young as 6 months old. The head of the Centers for Disease Control at CDC, Dr. Susan Minares, objected to those changes. Her lawyers say that led to her firing. Health and Human Services Secretary Robert F. Kennedy Jr. says the shots will be available to anyone who chooses them after consulting with their doctor.
Well, here with us this morning to discuss these new limits is CBS News medical contributor Dr. David Agus. He's also the founding CEO of the Ellison Medical Institute, founded along with Larry Ellison, part owner of our parent company, Paramount Skydance. Good morning, Dr. Agus.
Michelle?
The big question, who actually can get these shots and why are they eligible?
Well, people over 65 are eligible because those are the ones who have more complications to getting COVID-19. Remember, the hallmark of this virus is it changes over time. So all of us have had COVID. All of us have had some sorts of vaccines and probably boosters. But the immunity was to the old forms of COVID. As the virus changes, we need a booster so we recognize this new variant. There are new variants now that are different than the old ones. Over 65 eligible, under 65 or age 5 to 65, you need to have a medical condition in order to get it routinely, or your doctor can write you a prescription and give you a pass to get it.
Do you get the sense that those doctors will write those prescriptions if you're not in either of those groups and you just say, hey, I'm in my 40s, I'm in my 50s, I'm otherwise healthy, but I just like to get the shot?
My answer, very simply, yes. I'm sure they would. The problem is it's a barrier, right? And right now, still only 25% of people or so got the last booster. When you put another barrier in, you have to go to a doctor and get a prescription and then go to a pharmacy, et cetera. It's just another barrier and also puts questions into people's minds. Do these make sense?
Do they? I mean, if you're in those groups?
I'm in those groups, right? I'm under the age of 65. I don't have yet a medical condition, but I'm going to get it because I know if I get COVID, this will temper down my response and I will get better quicker. And that's what I want, right? Is I don't want to get that sick from COVID. So it's a personal decision, right? We all have some immunity, but I certainly would encourage people to get the vaccine or get that booster because it's out now in most states.
So you need a doctor's prescription.
Well, what happens now is most states. So there's 16 states where they're saying, hey, we're going to wait for this committee called the ACIP. And in those states, it's not available. But in most states, you put a check mark next to a condition. You say, I have depression, and they will give you the shot.
Where do the rest of us go?
The rest of us get a prescription for our doctor or just put a check mark on one of those and get the...
Wow.
I noticed a shh right there.
Well, listen, I want immunity. I want people to have the opportunity and make it based on their own body and their own value system. If they want that booster, they should be able to get the booster. Insurance companies, looks like they're all going to cover through 2025, so it will be covered. After 2025, we don't know, but my gut is they should cover it because it will save them money in the long run.
And Dr. Agus, these new guidelines also limit the availability to children. What should parents know about this?
So, you know, the current administration said, hey, pregnant women, breastfeeding women, you don't need a booster or a vaccine anymore. And I do believe that giving immunity to young children is tremendously important. There are complications to the vaccine. For example, you can get inflammation of the heart, but it is a fraction of that you see with the virus. So the virus itself causes this myocarditis. And so I do think that we all need some immunity to it. We should give children the opportunity to grow up without complications from a serious virus. So again, I would push for this right now.
All right, Dr. David Agus, thank you very much. We appreciate it.